I recall when arriving as a child, I have quite vivid memories of using the National Health Service, and growing up, taking for granted the fact that if you're unwell, if you need medical attention, you go to a local GP or you go to the hospital and you receive whatever tests or scans and then treatment, and you don't pay anything. It's something that I grew up taking for granted. And once I started traveling, seeing how relatives and friends and colleagues who lived in various places around the world, how they would expect to receive medical treatment, it became quite clear that the UK stood apart from the rest of the world in terms of the kind of National Health Service that it provided to everyone. I mean, the fact that anyone who's a resident of the country can expect that kind of treatment is absolutely amazing if you take into consideration the situation in America, in the Middle East, in Turkey, in the Far East, anywhere around the world. In fact, when I was much younger, I remember friends of my family coming to the UK from other countries, staying the holidays and then needing medical attention and receiving that medical attention, and again, for free. I recall vividly a friend of my father who visited the hospital 3-4 times and received treatment and then was given medication. And upon leaving the final time, he stopped me and he said, "By the way, we haven't paid." And I said, "It's okay, we don't pay." And he was almost hesitant to believe me. He said, "But we've been here for several times. I've received treatment. I've received X-rays, and I've been given medication. So how it could be?" I said, "Listen, this is how it is. You don't pay." That's something that, unfortunately, I'm not saying. I mean, still, it's that's the rule, that we receive medical care for free. But the state of the NHS is way different from how it was. It's quite clear for anyone who, la samah Allah, who has to visit A&E, for instance, or has to, wait for a scan to be had or a referral to be made. It's quite clear that the waiting lists are extremely long. The state of hospitals is nowhere near as they used to be. You find that the staff is absolutely overworked, overloaded, running around all the time and achieving, you feel, very little. So it's something that is quite remarkable, what has happened over the past, I don't know, maybe 15, 20 years, I don't know. But listen, both of you are practitioners, both of you work within the system, so I'm sure that you'd be able to tell me more.
I really appreciate what you just said. And I think what's important is for people to understand, especially those who don't live in the UK, but even those in the UK, what exactly the NHS is. Because I was on holiday with my family to Malaysia. And in Kuala Lumpur, they have these big skyscrapers and they're built with Islamic designs. And as we were going past these skyscrapers, like any rich city, you have poor people at the foot of the skyscrapers and they're begging. So we passed some poor people and some more poor people. And then we passed a lady, she had a baby in her arms. This baby had a huge head. Like the head was bigger than the whole body. This is a medical condition called hydrocephalus. The fluids of the brain, they're not able to drain into the body. So they continue to build up and build up and build up. The baby's eye gets sunken and the baby's brain is being squashed and the baby basically is dying. In the UK, it's a very simple procedure. You put a shunt from the brain into the body, it drains the fluid, the baby survives and grows up to healthy adult, no problem. This baby is there, clearly is dying on the street and his mother is begging. So we gave some money and we moved on. And one of my sons, he was small, I think he was 6, 7 years old. We were all quiet for a second. And then he turned to me and he goes, why is that baby on the street? And it was as if something snapped inside of me. You know, I didn't give him the politically correct answer. I told him, I was shaking. I said, this baby is on the street because from Malaysia to Morocco, we have enough oil in the Muslim world. Yeah. We have enough wealth. We have enough doctors. We have enough talent, but we don't have the heart to work, to build a system to look after our people. And in England, they did. They built it, so not one baby will ever die on the street for a disease that can be fixed. They will be in hospital. It doesn't matter how much money they have in the pocket. Yeah. But in the Muslim world, it matters how much money you have in your pocket. That's how much care you'll get. And if you don't have enough money, your babies will die on the street. Yeah. This is the difference the NHS makes.
Yeah, and you know, it's telling that people who go on, you know, for extensive treatment, you know, either for cancer, for instance, or for any long-term illness. And again, it's almost remarkable that the best of equipment, the best of medical minds and the such, they're at that patient's service, and no one is going to ask, you know, how much money do you have in your bank account? Are you rich enough to pay for this bed that you're occupying for probably weeks? No one asked that question. And Doctor, you have also experience of this.
Yeah, that's luckily that we don't have that like across the Atlantic in America. That's the system. There's about more than 30 million Americans. They have no at all, not even basic insurance, medical insurance. That's why I think we are lucky here to live in UK, because it's, as Dr. Wajid said, it's one of the best systems in the world. It's even if you're a resident, as long as you have emergency, you have something to need, medical care can be there to you free at point of delivery. It's a very safe organization, trustable. The health professional themselves is one of the highest trusted people in a lot of research when people's opinion was taken, contrary to politicians, for example. And that is mainly because people know that these are people working hard to get their health in the best way. And nobody will ask you for a penny. That's the system that we are now celebrating 75th anniversary of it. But amazingly, these things not continuing like that. Unfortunately, there's a lot of challenges now. COVID did give us some leeway to try to open our eyes that there is a lot of challenges that haven't been dealt with before. Unfortunately, a lot of bad management in the NHS over the last 10, 20 years, or maybe even longer. So there is a pressure of the NHS from within, pressure from outside, and pressure from the patient and staff. So for example, pressure from outside, you got the pressure from pharma to push for new drugs and expensive stuff. Medical industries pushing for more devices and stuff. And again, policies, government policies, political correctness, all that can affect.
This is quite fascinating. I mean, it's incredibly frustrating because you're talking about bad management, but we're talking here about a project that is at the very heart of every single society. We're not talking about a side business. We're not talking about an industry that is secondary. If it fails, it's not that important. This is something that affects every single human being who is present in this country. And of course, even from an investment point of view, I mean, investing in people's health is one of the most strategic investments that any government, any country should absolutely look after. It's central to the future of the country, to the present of the country.
But who will know better than Muslims what's going on here? An amazing people operating in a system that's failing. So a good person in a bad system is going to fail. And unfortunately, the NHS is in a system that is pushing market economy, capitalism. The NHS is bad for pharmaceutical companies because they negotiate the lowest possible price. It's bad for shareholders because they're not going to make money from the big companies that are going to establish private healthcare systems. It's bad for the rich because it's helping the poor, and the rich have to pay taxes to help with that. You know, you don't have to pay at the point of use, but somebody has to pay the taxes. It's bad for the powerful Because a sick society, and a society that's constantly worried about its bank balance and how it's going to pay for the doctor, is a society that's quiet and is stable. Who will know more about it than Muslims?
So what's the alternative in the minds of those who are making the decisions? What's the alternative to the current situation?
I mean, now, I think in the last 10, 20 years, we are seeing, I mean, I've been working in the NHS for 22 years, and I can compare my time when I first started and how things were done and how things now. People now are more exhausted. Since COVID, we know that people all overstretched, staff morale going down, payment is not as good as we can see. We see junior doctors and nurses are striking. All of that indicate bad management of the system, because per capita the NHS spending less than any European counterpart.
It's incredible.
And despite that, this is totally free. Yeah. So there is bad management in that, and I can remember once upon a time, without putting names, one of the prime minister of the country didn't want to invest in obesity treatment at all for us. He only put money for the children, for the future, but not for us. So as a lost hope. Yeah. That is not a good decision for politicians.
I'll give you a very good example of what bad management looks like. You have in the hospital the junior doctors and the senior doctors. What do they eat? Food is very important for human beings, right? If you sit in a first class in an airplane and economy class, what's the difference? Do you get there 1 hour earlier? Do you have less turbulence? No.
It's the quality of food.
It's just the quality of the food, and you got a bit bigger seat. That's it. Yes. For this, you're willing to pay 4 times more than economy.
Correct.
So it's important for human beings. What do they do in hospital? What do doctors eat? Exactly the same food as the patients, which is almost, I will say this, unreservedly, garbage. It's unhealthy food that they give. Do you give Coca-Cola vending machines? There's no hot food. If there's a cheese sandwich, cheese and tomato, cheese and pickle, and then you can go home, go hungry. Then so the doctors, they feel, the junior doctors and the senior doctors, they feel like when you go to work, you have to pay to park. And then, even then, if you pay to park, half the time there's no parking space. Yes. So you're stressed before you get to work. There's no food there for you, or if there is, it's not very nice food. And there's no consideration for you in terms of anything. Like if you have 1 minute to rest, there was a place called a mess where the junior doctors could go and rest.
Yes.
They took it away and made it office for managers. So when you are constantly treating your staff like that, then of course your staff is going to say, I'm not going to work 1 extra second for you. I'm going to try, you're looking after yourself, I will look after myself. But if you look after your staff will look after you, and they will look after the people. So it's the whole management system. Again, I go back to the Muslim world, I want to make it relatable. We're good people operating under very bad management. Yeah. And the managers, unfortunately, are creating a system in which the good people will fail.
It's, this is fascinating because as a layman, when it comes to the medical services and the health sector, I would naturally expect that any discussion of the NHS would be sort of talking about certain medical aspects. But unfortunately, you very politely call it bad management. I wonder if this whole erosion of the NHS is actually by design, is actually done deliberately on behalf of certain politicians. You said, Wajid, capitalism and the fact that people are looking at shares and the value of shares and the such, and that these considerations, in the eyes of many, seem to be far more important than providing a decent care of the workers within the medical sector, as well as the patients in extension. I'm reminded, of course, the discussion that we had over the past 6-7 years in America was about healthcare and about the health sector. And President Obama made a big thing about his project for reforming the health sector. And, the information, and it's scattered information, but it's quite frightful information about how things are in America in terms of providing health. It's scary. So unless you have proper and full medical insurance, you need to be very careful and pray day and night that you don't fall ill.
Because that's our future. That's the scary part.
Yeah, I mean, I recall very well a friend of mine who works in the Silicon Valley. So he's fairly well paid. He was willing to take a very big pay cut to move to another company. And the reason he said because they have better medical and dental care. And I said, well, you know, he said, no. This is worth hundreds of thousands of dollars. Because if in my previous job, although I'm paid much more, but if I was to fall ill, I would be expected to fork out from my own pocket tens of thousands of dollars probably. And this led me thinking that, is this what, our government, this as well as previous and maybe even previous to that, is that what they're looking for?
I think so. I think I'll give you an example. I'm a cardiologist. In America, there's something called chest pain clinic.
Yes.
So you go from one door, you have any pain in the chest.
Yes.
Within 3-4 hours, you'll get from the other door with a bill $50,000 to pay. They do all the investigation for you, needed or not needed, but you'll end up, you have to sell your house for that. Right. Now, I can compare that. Does that the system we want? No. Yes, we might be here in UK that people have to wait 2, 3, 6 months to see a cardiologist. Fair enough. But at the end of the day, if they're unwell acutely or very urgently, then they go to any. Yes, they have to wait 3-4 hours, but still it's free. So even by comparison to the managed care of America, when there's more than 30 million not even have a basic one, and even if you have, like your friend, you have levels. So yes. You might have your level. If you have chest pain, that might not be entitled to bypass surgery for your heart. You still have to pay. So it's a huge stress for people. That's why we have to, all of us, we have a responsibility, especially us, the Muslim.
Yeah.
Because this is كلكم راع وكلكم مسؤول عن رعيته. Whether we are a patient or a staff or people, or manager or people in politics. Now, a lot of Muslims now coming in, that we have to take responsibility to say enough is enough. Yeah. We need to start changing things to the better.
Yeah.
I can remember I was used to work in Yorkshire, and my friend was a big surgeon, and they told him, look, 10 years ago there was only one manager in the theater, and he was managing 20 consultant surgeon. Now there is 10 of them, and they're not as good as Jones, the previous one. So this is part of the problem of the NHS.
By the way, I mean, you mentioned a story that I was just reminded of just recently was of a patient who suffered some sort of concussion in America, this is, and had to go to hospital. Apparently some documents were given to her, and in a daze she just basically signed, and she wasn't aware of the fact that she signed on a document that sort of allowed her full sort of care, which she didn't feel that she was cared for more than normal, and for one night's stay she was given a bill of $34,000. That's almost 29,000 pounds. It's, I mean, you think, you're not exaggerating when you say you sometimes need to think of selling your own house in order for that one night in hospital. I mean, I'd love to think what the $34,000 are for, but regardless. And you also remind me of something important. I mean, I'm saying that in modern times, and around the world, the NHS does stand out in terms of the theory is, the idea is, what I experienced for many decades of my life is that you get the treatment that you need, and then you leave without having to pay a penny. This is sort of exceptional in our modern day situation, but actually, and you reminded me just now by talking about Muslims and Islam, the very first hospitals and healthcare systems that were built in the entire world almost by Abu Bakr al-Razi and by others, by Muslims, it was free. It was seen as part of the rights of every citizen who lived within the realm of the Muslim nation.
Yes, I do. I've done lectures on this called the Bimaristan.
The Bimaristan, yes, exactly.
The system that was set up is something, again, we don't study enough, but it had a financial system which was similar to the NHS, but a little bit more sophisticated.
Wow.
Than the NHS. And it had a system that was holistic. So just one aspect of the Bimaristan, which I think if the NHS was to adopt this model, I hope one day the Muslims re-adopt their own model, it could save it. Part of the Bimaristan was to educate the population. They had, part of the role of the hospital was to teach the population, because they understood the doctors and nurses can only see a small number of people, and by the time you see them, the disease has happened.
Yes.
So we need to educate the general public on health measures, so that
prevention, basically.
Prevention, and also that they can deal with issues before they come to us.
Yeah.
And they understood that this is going to be the real game changer. So they were able to get out there and educate people on good mental health, or on eating and drinking and so on and so forth. And it had an impact. It meant that there was a manageable impact of the number of people who were coming.
Yeah.
And it also meant that the population was less likely to take advantage of the Bimaristan, because they understood that we are working together. We're a team in this. When a patient was discharged from the Bimaristan, I love this story, because the criteria for discharging a patient was that they were able to eat 1 baby chicken and 2 loaves of bread.
Wow.
They were able to finish this, then they can be discharged, they're healthy.
Incredible.
And when they were discharged, the doctors, the nurses, and the patients celebrated together, because it was a team effort. Now, this is something we're missing.
Yeah.
Right now, everyone is like, if they have the smallest problem, they come to the NHS, they misuse medication, they misuse time of the doctors, they miss appointments. It's a two-way street. We need to work together.
And that kind of holistic system. I mean, okay, since you brought this up, you both are members of, and you're a founder of, the British Islamic Medical Association, BIMA. And I personally, I'm on your mailing list, so I receive your letters, I receive your, the courses that you hold, the lectures that you host, and the such. And I have to say that it's one of the best manifestations of Islamic ethics within a particular sector, in this case, the health sector. And I'm overjoyed to learn that only recently you celebrated the 10th anniversary of BIMA. Long may it continue, inshallah. Tell me a little bit about BIMA. You're one of the founders. Where did the idea come from?
I think the idea is that we need to change things. The same thing we're talking about, enough is enough, because at certain points, the Islamic ethos, إِنَّ اللَّهَ لَا يُغَيِّرُ مَا بِقَوْمٍ حَتَّى يُغَيِّرُ مَا بِأَنفُسِهِمْ. When you start noticing that there's something wrong, I need to start changing things. Because I used to be a member of other 2-3 organizations, I'm still a member of them, but most of them, like social activities, they come only once a year, Eids and parties. But no actual. In fact, I once phoned them and said, look, I'm in Yorkshire, in Scarborough at that time. What do you do for activity for me? Even in New York? No, it's all Birmingham or Manchester or London. So BIMA was started by a group of people, which was at that time around less than 185 people, sitting in Mark Feed Institute saying, we need to change things. We need to see how, as a Muslim, how we can improve things. And alhamdulillah, within the last 10 years, with a lot of young people like Dr. Wajid and the rest, mashallah, participating with a lot of ideas, BIMA have done a lot of good work.
Fantastic.
Mashallah. Even for the prevention side of things, we've got many projects. We've got the Lifesaver, in which we teach people to save lives in the masjid, which is in fact da'wah, as well as counteracting politics of all bad impression about Muslims and terrorism, everything about mosque. This is saving lives in the masjid once a year, in collaboration with the British Heart Foundation. And they started growing from 3 masjid in London to more than 100 masjid, and even becoming international now. More than 10 countries internationally adopting the same position. And we got a lot of work on inequalities. We got some on bare below the elbow for ladies, having theater hijab, how their challenges in the theater and all of that. So we got a lot of work. I think Brother Wajid will probably...
Well, how many members do you have right now?
I think our membership is over 6,000-7,000 now, alhamdulillah.
Fantastic.
It's as Dr. Amr said, BIMA is 3 words: unite, inspire, serve. The first word is the most important.
Unite, inspire, serve.
Fantastic. The first word is the most important. There were loads of Muslim doctors, nurses, physios, pharmacists, dentists, all across the UK, tens of thousands. Did you feel the impact? Probably not, unless you physically knew one or you were one. You didn't feel the impact of this. When the government wants to do a policy shift, who do they speak to? They just speak to their random Muslim friend. They don't know who to speak to. When the pharmaceutical company wants to know about something, who do they speak to? Nobody knows. When the imam wants to know, is this mental health or is this, do I do ruqya? Who do you speak to? Nobody knows. When somebody wants to go into dentistry, if he doesn't know any dentist, he's stuck by himself. The idea is that united, we're stronger. If we work together and we're united as Muslims, we come together all across the country. It doesn't matter if you graduated in Iraq or you graduated in London. It doesn't matter if you're a professor of medicine or you are a first-year midwife student. It doesn't matter if you're from Africa or from Pakistan, and it doesn't matter if you're in Wales or if you're in London. We are one. We're all Muslim healthcare professionals. When we come together, then the barakah of unity is, for the last 10 years, we've seen it. As Dr. Amr said, teaching CPR in masjids. I'll give you one statistic. The out of hospital cardiac arrest. That means somebody their heart stops and they fall and they're dead. If that happens outside of hospital, on the street, in the house, in Seattle, Washington, in America, the chance of survival is 33%. 33% chance that you will still live, because every single person in Seattle knows how to do CPR. They've been taught in school. It's mandatory. In London, everyone is not taught, but we have heart attack centers. So in London, it's about 15%. Because even though most people don't know CPR, but you're very close to a hospital that will take care of you. In Karachi, which is a city of more than 20 million people in Pakistan, it's 0%. In Kuala Lumpur, it's less than 1%. In most of the Muslim world, it's between 0 and 1% chance. Why? It's just a piece of information. It doesn't cost any money to learn this information. It takes maybe half an hour, 1 hour to learn it. But we haven't come together to teach it. So this is one example. We were teaching it in BIMA. We said, right, we're going to teach it in the masjid. It's free. This is where the Muslims are. And we will invite the non-Muslims here as well.
Brilliant.
10 years ago, we taught in 3 mosques. Last year it was 13. This year, last year it was 150 mosques. 13 other countries are doing it. This year, 20 other countries, inshallah, in next month. A month and a half we'll be doing.
It would be fantastic, by the way. I'm just a thought that came as you were saying. It would be fantastic if you went to schools and taught children.
Yes, we want the children to come to masjid.
Okay, but no, it's absolutely fascinating what you're telling me, and the work of BIMA, I have to say, I became more aware of during the time of COVID. I became more aware of from 2020 up until now. That's when I really realized that. Well, 2 things happened. The first is obviously the fact that here in the UK, all of a sudden, everyone started appreciating the NHS and who was working for the NHS. Remember, we were every Thursday, clapping and banging on pots and pans, including the Prime Minister. So all of a sudden, we appreciated the NHS.
In between his parties, I think.
Yeah. So the realization of the importance of the NHS, but more importantly, from at least my point of view, and I tweeted about this and commented about this, that the first victims of NHS, those who died on the front line as they were treating patients, were Muslims. The first 4, 5, or probably even 6 doctors and nurses who actually gave their lives because they were serving COVID patients were Muslims. And that was highlighted and that was brought to the fore. And with that, the realization that there was something called BIMA that existed and that, capitalized on people's appreciation all of a sudden of the importance of health service and the role that Muslims play within the NHS. And this is something that I was always aware of, but we never had the numbers and statistics. For instance, I recall very well, I had in my youth, I had to stay in hospital for about a week. And I recall from, the nurses to the doctors to the anesthetists every other guy was a Muslim, either from Asian descent or from Arab descent or from African descent, or it was quite, and this led me to think that the numbers of Muslims within the NHS is extremely substantial. I've heard some numbers, I can't verify whether they're true or not, but we're talking about hundreds of thousands. We're talking about hundreds of thousands of Muslims who serve within the medical sector and the health sector, and have an incredible contribution to make in treating, helping, assisting, and saving people's lives. So from this, my guess is that there is incredible area for us to make a contribution as to how we can save the NHS and then rebuild it once again to be what it used to be.
That's why, as Brother Majid said, unite the first stage, and then the next stage, inspire and serve. Yeah. That's why our organization in COVID was exponentially increased, because we've done COVID response group, which was very in the front line. Yeah. We managed to put, remember there's a lot of, misinformation about the COVID infection itself, about the vaccine.
The anti-vaxxers.
Anti-vaxxer. Yeah. And we managed to put a very nice slide about it in 15 languages, including Polish, which not a lot of Polish community is Muslims, to try to address all the local languages available to try to address this reluctance. In fact, my hospital at that time when I was working in areas of Manchester approached me saying, look, we got staffing issue, that having a problem not taking the vaccine and their staff. So I managed to cooperate with them with BIMA and do Facebook open discussions, no need to mention even your name, just confidential, just what's your, and talk about. So Alhamdulillah, BIMA worked a lot on that side, frontline, a lot with other projects they are doing. So that's the beauty of coming together. And BIMA is the only medical Muslim organization in UK who accepts not only doctors, but nurses, physiotherapists, dentists, pharmacists, even chaplains. Anybody working in the NHS, you are welcome to become a working member in BIMA.
What kind of values does BIMA try to instill in its work?
It's Islamic values. We're very upfront that this is an Islamic Medical Association, not just association of people who happen to be Muslim and working in healthcare. So what does Islamic value means? I mean, it means we're trying to implement really a clean slate where we say, let's go back to basics. This is not one where we want people fighting for positions. Yeah. As soon as someone starts fighting for positions, that they understand the culture in the organization is not accepting this. This is not somewhere where we're running after money. We've run a lot of these projects with zero budget. In fact, we wanted to approach charities, as most organizations, Muslim organizations do. Let's get charity money. And our treasurer at the time, he said, we're not taking charity money. And we said, we don't have any money. We need money from somewhere. He said, no, we are going to pay charities money. This is not, we're going to stop having this mentality where we're taking. So we're really trying to think different to maybe what's happened before sometimes, because we've seen a lot of iterations in other places where things haven't quite worked out. Yeah. And we're looking at where the pitfalls are. Unity is very hard to safeguard, but it's important. We could easily have become the Pakistani or Indian Islamic Medical Association. Yes. We have to actively fight against that. Yeah. We could have easily become the Brothers One. We have to equally fight against that. So our head of our council is a sister. For example, not because she's a token sister, it's because she's the best person for the job. Yeah. We could also become the London. We fought against that. We could have become the Sufi, Deobandi, whatever. But we actively always trying to make sure that every time we go right, we're trying to move a little bit left. We have to always try to come back to that middle ground. We are for everyone, inshallah. And the focus is on the work. So you if you work hard, you can join BIMA tomorrow, and the day after tomorrow you could become president. We're going to base it on your work rather than on who you're from, who you are, who your friends are.
Do you have discussions, even internal? Do you have discussions about the state of the NHS, about the challenges that you face, about government funding, about the long waiting lists, about all these issues that we've briefly touched upon?
I mean, Brother Wajid said with COVID now, because as you know, politics always, whether you are seen at doing something. Yeah. Alhamdulillah, now BIMA have been looked at that as a trustable organization, have done a good work. So consultation with us starting, but that's when we have to start talking about inequalities in IMG, medical graduate, international medical graduate, people who graduate from where, how we can rehabilitate them, how we give them help. So we are now trying to, but that's the current stage. But the first stage was the first 10 years was establishing. Now inshallah, we're trying to move on to try to be more influential in changing the narrative and give option of solution, how we can improve things.
Do you happen to have meetings with government ministers, with the health department?
We've been invited to, we've spoken to the Secretary of State for Health. I believe that some of our members have met the Prime Minister a few times.
Right.
But it's not something we chase.
Of course.
And we have a lot more relationships with NHS, directors and so on.
Okay.
And again, it's something where we're not knocking on their door; they're knocking on ours, and we think that's the right way. Because if we knock on their door, then you come without respect. If they knock on your door, then that means that they respect what you've done.
Yeah.
And we will engage with them, but we are having those discussions. You're saying, what is the future of the NHS? But right now, I have to be honest. This is what Dr. Amr said, that we need our community to be in a much better position to not just have the discussions, but to do something about it.
Right.
So at the moment, we're working towards that. We're working towards getting our own community. There's a lot of health problems in our community. There's a lot of health inequalities. There's a lot of areas that we can improve on.
When you talk about health inequalities, what exactly are we talking about?
I'll give you one. The average life expectancy in this country is 81 years old.
Okay.
Do you know what the average life expectancy is on Whitechapel High Street in East London?
In East London, Muslim area.
51.
Wow, that's a huge disparity.
We don't even know this disparity. The number of Muslim teenagers who have thought about suicide at least once in the last 2 years is 1/3.
Wow.
The number of Muslims from India, Pakistani, or Arab background, Indian and Pakistani background who smoke is close to 50%. The average in this country is 18%. As one Muslim researcher, who's a professor in Manchester, he said that the Muslim community should be preparing itself for a tsunami of cancer that's going to hit it in the next 10 years. And I told him, I was sharing the session, and I told him, those are two words nobody wants to hear in the same sentence, tsunami and cancer. And I said, why? And he said, our women don't do mammograms. Our men don't go for prostate exams.
Yeah.
We ignore health warning signs. And we smoke, and we have high rates of diabetes, and we eat meat like it's going out of fashion. So it goes that we pretty much are getting ourselves ready. The next 10 years, because we're a young community, we haven't seen it yet. Average age is young, but in the next 10 years, the average age will not be young. Wait for the tsunami that's going to hit you. We still have time to reverse this trend right now. So these are the things, these are the conversations we want to start having.
This is scary, especially if you combine this with the gradual decline of the NHS service. That is fairly scary. I mean, you're talking about a real crisis looming.
I'll give you another example, organ donation.
Yes.
We find the first one about 10, 15 years statistic from Bradford area that the Asian, the majority Muslim, donate organs 2%, but they receive organ 8%.
Wow.
So there is hypocrisy in that.
Yes.
And that's why do
you address those issues?
Yeah, so we got a project now which is organ donation. In fact, last year this is one of the few funds we took from the NHS blood and transplant. We produced the first film organ donation film by Muslim community by BIMA. Which is done by professional, paid for it by professional and it's a very good film. We hiked to Ben Nevis, the largest beacon. Myself was there with my son, and we raised awareness that this is a problem. You need to talk to your family about organization.
I'm assuming that you refer to fiqh councils and Islamic scholars and the such.
They're on our team. So so BIMA is where we work with the scholars from a variety of different backgrounds. And the other thing that we do is that we're trying to understand that there is a difference of opinion. So we're not here to say this is the way and that this is the other opinions don't count. We say there are differences of opinion. We want you to be aware that there's a difference of opinion, and we want you to know that there's pros and cons of difference of opinion. Now you make the choice.
Right.
And we feel confident that when people are aware of this information, that most people will go towards one angle, but it doesn't mean that everyone will. There's a unity of purpose, not a uniformity of the views.
Of course. I mean, in regards with issue, I mean, you've just mentioned something that never occurred to me, to be honest. But now thinking about it, I mean, it's something which is extremely serious, and the kind of disparity in terms of, how much, what's the percentage of Muslims giving and then taking. It does show a huge problem.
That's my card.
And this is the card that you would recommend.
If you are registered and you are allowed by law to say, like from Islamic perspective, you're not going to donate your testes or your sperm. So you're allowed to say what organ you want to donate.
Right.
And even if you after...
This can be applied for online?
Yes.
Right.
And they'll send it the card for you. Okay. So, but what I'm saying is that start the discussion, even, God forbid, when you die, if your family still have the decision to reverse that.
Yes.
But please, by all means, the verse is clear. وَمَنْ أَحْيَاهَا فَكَأَنَّمَا أَحْيَا
النَّاسَ جَمِيعًا. What role do you play in providing care, guidance, education, even for young people who are interested in pursuing a medical career?
At the moment, we're developing that. What we're doing is something is very interesting. It's a project which we hope to roll out all across the Muslim world. It's called ACE. And in this project, what happens is when you get to the end of medical school, dental school, pharmacy school, they teach you medicine, dentistry, pharmacy.
Yes.
They don't teach you how to be a doctor. Or a pharmacist.
Right.
They don't teach you how to book leave. What Jum'ah time, you have to pray Jum'ah, and you have a ward round. How do you do that? They don't teach you this. They don't even teach you how to do an on-call, to be honest. Unfortunately, the system teaches you the subject, but not how to apply the subject.
How to apply, yes.
So we saw this gap. And what we did is that we say at the end, when they finish their final exams, medicine, dentistry, pharmacy, not just for Muslims, we hold a course where we tell them we're going to get people who have already gone through this.
Yes.
They're going to tell you the top tips.
Right.
2-3 hours, top tips on how to go through on-call, top tips on how to keep your boss happy, how to get Jum'ah prayer, how to make sure you don't miss Eid, and so on and so forth, how to deal with Islamophobia, all these kind of things. And it's a free course, and at the end of it, the last 10 minutes, we tell them, guys, we took our time out of the day, we brought you here, we gave you food. Why are we doing this? We're doing this because we want you not just to be another Muslim doctor, dentist, or pharmacist. We want you to become an active member of the Muslim community. You need to be leaders. You need to get involved. You see what your community is, the situation, the dangers that are approaching it. Let's work together. That's all we're going to. We want them to become active, rather than just another Muslim name, and they could have been anyone else. And this has been very successful, alhamdulillah. It's been growing every year. We're getting hundreds and hundreds of people coming through, going through that and really benefiting from it. And eventually we want to get to a stage where we're going to encourage young Muslims who want to go into these jobs on how to do it as well.
How do you deal, whether as an organization, as BIMA, or as individuals, how do you deal with complaints of discrimination against Muslim practitioners, whether nurses or pharmacists or doctors or the such? And I remember reading a few months ago a report about Islamophobia within the medical sector. So what would your role be, or what would your advice be to someone who suffers that kind of discrimination?
We have a team that deals with that as well. and we have some sister organizations who do a lot of work. What we tend to do is we tend not to take a reflexive approach. The reflexive approach tends to be, Muslim says, there's Islamophobia against the workplace, and then we say, let's make a us and them battle.
Yes.
There's a winner and there's a loser. What we tend to have is that definitely there is a lot of Islamophobia, conscious or unconscious, or whether it's systemic or individual in the workplace. And what we try to do is we try to come to an understanding where we make the system and the people within the system understand that, look, this isn't in advantage of the system and that this is something wrong going on here. And what we find is that most reasonable people, if you approach them without an accusation or
the hostility
at the beginning.
Yes.
If you approach them in a much more calm and a productive manner,
yes,
they're willing to accept that something's gone wrong.
Right.
And they're willing to change the system. So, for example, as Dr. Amr mentioned, bare below the elbows.
Yeah.
It's not scientific actually. It's only in the UK for some reason that you have to not have anything below your elbows because this is a transmission vector.
Right.
I don't know where this came from, but it's like almost like as if it's a religion.
That's how it is.
In this country. And this is a problem for Muslim sisters because some of them don't want to go bare below the elbows. There is legislation that says that they shouldn't have to contravene their religious principles. Just like if someone is Sikh, they won't have to remove their turban.
Yes.
Even though you have to, you should wear, everyone else should wear a helmet, but the Sikhs don't have to wear a helmet because they're exempt because of their religious reasons. So when we approached and we talked through this way, what happened is you find allies. They say, yes, we agree with you. Let's come up with a flow chart, a system, so that if someone has this problem, this is how they approach it. Once 1 or 2 hospitals agree it, then one trust agrees it, then 3 or 4, then even the ones that don't want to agree with it, then we say, look, but the others are doing it. Yeah. They start falling into line.
Okay. And I mean, it's a difficult subject, but I have to ask, does BIMA concern, or is it concerned with training or educating regarding how medical professionals deal with those who are towards the end of life, patients who are on their deathbeds, who are gravely ill? Does BIMA provide any kind of assistance how to address the families, for instance, who are aware of the fact that their loved one is about to depart? I mean, tell me a little bit about this.
We did participate in the consultation about assisted dying, the bill. We had a group in BIMA working on that. But obviously, the medical opinion slightly shifted regarding that. We trying to put our opinion that we are still thinking that what is in the law still can work for everybody, including people who want to be to have that approach of they want to not have full medical treatment. And so there is way that we are working on that. But obviously, that all need everybody to be engaged on that.
Yes.
And it's not an easy subject because dying is in any cultures is difficult to talk about.
It's a very tough subject.
And it's sometimes if you don't approach it in the right way, it can backlash.
Of course.
So you have to have a very, very conscious.
And obviously, I'm also aware of the fact that sometimes personal traits and sometimes people individually, they have what it takes to deal with those situations well, and others who find it very difficult. I realize that. But let me also ask about another political football, and especially in America, and that is the case of abortion. What does BIMA have a position on abortion?
I don't think we need. So we had a discussion around it, and we felt that this is a fiqh issue, and we have to be clear that we're not faqihs. We don't want to intrude into the space of the scholars.
Okay.
Where there is a question for a medical input, then we will provide our medical opinion on the medical side.
Right.
But we want to leave the scholarship for the scholars as well. So what we found, and when you talked about COVID. What worked beautifully for us, it wasn't just that it was BIMA only. I think right at the beginning of COVID, when we started realizing it was going to become a thing, we spoke to the Muslim Council of Britain and we said, listen, this is a medical emergency. We want to run it like a medical emergency. That means we need all the right players in the room. We need the imams, the scholars, the Muslim community leaders, and the medics, the infectious disease. We need all of them in the same table. We will lead it because it's primarily a medical emergency. And to their credit, they agreed to this. So this is why the system came out so strong. Before any other community, this is something the Muslim community should be proud of. Before any other community closed their place of worship, the Muslim community was the first, 1 week before the government did. You would think that we would be the last because we would fight to the bitter end, and that's what we would normally do. But because those relationships were there, it wasn't me speaking to an imam of a mosque that I never knew.
Yeah.
I spoke to someone I knew, I've been working for 10 years with. They trust me. And when the NHS asked us, how did you do what you did? Because we thought that you guys would be the most backward when it came to this.
Yeah.
We told them one phrase, which they've really taken on board. We said, the messenger is as important as the message.
Very important.
You can't just give the message
Very important.
and put it on the Daily Telegraph and then say, why didn't anyone listen? Nobody reads the Daily Telegraph from my community.
Yeah.
Or put it on the 10 o'clock news. It needs to be from people they trust, in a language they trust, in a location they trust, in a way they trust. And if you do it, just like with the COVID vaccines, they were complaining. They started complaining straight away, oh, Muslims are not taking the COVID vaccine, Muslims are not taking it. And we said, give us a chance. You've tried to tell them, again on the 9 o'clock news, let us talk to them. Look what happened.
Excellent. And it's quite important, and I agree. Yes.
And on that, just to comment on, also we got a journal of BIMA, which publish a lot of ethical views regarding that debate about the ethical side of things. We also got a project of the ethics committee in BIMA itself, so debating all sorts of things, and a lot of that published in Journal of BIMA, which is a fantastic journal. It's now coming to its fourth year now. Excellent. So it's again production of BIMA. So there is all that debate, whether you are with or against. It's an open access for you to put your way or look at it.
Very good. I think it's also important to ask about how much or little BIMA is concerned with medical outbreaks internationally, medical emergencies internationally. For instance, when we talk about the war in Yemen, the biggest problem of the immediate impact of the war in Yemen is children, cholera, and all the array of diseases and illnesses that have become on an endemic level. So how much does BIMA concern itself with that? Do you have an international arm whereby you reach out to doctors and practitioners around the world and give them training or advice or the such?
There is a body called the Federation of Islamic Medical Associations. So it's our umbrella body. We're one part. And there's 30 to 50 organizations. So there's Islamic Medical Association North America, Islamic Medical Association of Saudi Arabia, and of many countries, Pakistan, Indonesia, Malaysia. And they do look at the global picture and of relief work. And we're part of that. We're an active member.
Right.
We're different. We're a very unique member. When we joined our first meeting in Amman, myself and Dr. Sharif, who was the ex-president of BIMA, every country has to give a presentation of their activities for the year. And we were the last one because we're the newest member. And the whole day, they were all giving their presentations. And just before it came to our side, Dr. Sharif turned to me and said, do you realize that every single thing that every other country has said is irrelevant to us because of the NHS?
Wow.
Because they were all celebrating, that we did 1,000 cataract operations. Wow. We gave vaccination in this town, in this village.
Yeah.
He said that, we have an opportunity because they are trying to deliver the basic services to their people. And we have the basic services.
The basic services are
we can go
available.
to the next level.
Yeah. Yeah.
This is your audience is from all across the world. My plea is that we don't want just the British Islamic Medical Association.
Yeah.
We want a German Islamic Medical Association. We want French. We want Italian. It's possible. We're willing to come and help set it up. We need to find those people who are willing to work with us. Number two, if you're in the Muslim world, this is how many more people have to die before we realize that the NHS is not amazing. What's amazing is the Bimaristan, our model that it was built on, let's reclaim our heritage and let's rebuild the healthcare system from the ground up. Instead, what we tend to do...
And for the benefit of everyone. Everyone will benefit. Muslim and none. Everyone will benefit.
The way we think right now is that if I want to help the health of my community, I will build a hospital. We say, no, that's not the Bimaristan way of thinking. You build a system.
A sector and a system.
A system, exactly. Which will build hundreds of hospitals and which will educate the people before they get into hospital. Building one more hospital is like throwing something into the ocean. It has an impact, but it will be swallowed up.
Thank you very much, both of you. This has been a fascinating discussion, mashallah. Jazakumullah khair.
Thank you.
Far more fascinating than I expected, I have to say. I was thinking to myself, okay, so...
Boring doctors.
What's we going to talk about? Because, from my point of view, I'm a politician. So I talk about government policies and about this and that. So I said, these doctors, what are they going to talk about? MashaAllah, tabarakallah. Ahsantum. Really, thank you very much. I appreciate it.